The Walton Centre is a specialist trust. Indeed, we're the only standalone specialist neuroscience trust in the UK, which covers a population of about 3.5 million. And we provide services for patients with disorders of the brain, spine, peripheral nerve and muscle, and trauma surgery for head and spinal injured patients. We provide secondary and tertiary services, so patients referred by their general practitioners or by other hospitals and often other neurosciences centres throughout the UK. We're a small hospital in terms of the number of beds that we have, less than 200, but I think this helps us to maintain the great pride that the staff have in providing very high quality, excellent clinical services. However, we're very large in terms of the services that we provide in neurology and neurosurgery, right up there with the very largest in the UK. We have a catchment population of about 3.5 million, and all the organisation for those services are performed here at the Walton Centre. It's very important to us to be a standalone specialist trust. What that means is that we can respond very quickly and as we want to external factors, to the requirements of patients, to the requirements of the service, and of course to research partners when they approach us. Our research reputation was founded on epilepsy studies and pragmatic research into very practical issues into the management of epilepsy, led by Professor Marston and his group. We also have a reputation for neurological infections, particularly brain infections, in the group enjoying an international reputation led by Professor Tom Solomon. We're extending our research into the fields of brain tumours, hydrocephalus, and the management of patients with sciatica. We're currently looking at ways in which we can try and prevent patients with epilepsy being admitted or readmitted to hospital with the recurrence of seizures. We're setting up new services, an innovative way of designing these services, and the cooperation of the partners in the LHP has been essential for this. Cooperation between the hospitals and providers in the region has enabled us to set up a highly integrated rehabilitation system which involves patients with the most severe disabilities being looked after here at the Walton Centre initially, starting very early into the course of their illness, and then as they get better they can then be moved out into the other units across Merseyside. We've already shown that this has produced much better clinical outcomes and at a greatly reduced length of stay, and so greatly reduced expense to the health economy.